All right, everybody else that's currently standing, quietly walk back to their seats. Well, this is taken from the DHHS website. The New Hampshire Department of Health and Human Services is New Hampshire's largest state agency and is responsible for health, safety, and well-being of the citizens of New Hampshire. DHHS provides services for individuals, children, families, and seniors, and they administer programs and services such as mental health, developmental disability, substance abuse, and public health. You can probably assume that it's the heart of New Hampshire. With its $2 billion budget, DHHS employs 2,900 employees, and they work in approximately 50 workplaces across the state. In August 2007, Nick Toumpas was appointed acting commissioner of DHHS, followed by his appointment as commissioner in January 2008. And in December 2011, Nick was reappointed to another 4-year term as commissioner. The enormity of DHHS makes it an easy target for state budget writers. And every 2 years, Commissioner Toumpas has had the duty of juggling what the legislature budgets his agency against maintaining the safety net for our state's fragile populations and those people most in need of services. Commissioner Toumpas is here tonight to let us know the challenges he's facing in the current legislature while maintaining the safety net as best he can and keeping his department viable and relevant in the future. You're probably not aware, but Commissioner Toumpas and I have worked together in our early years in the Office of Community and Public Health. And I'd like to think that I played some role in his success. Of course, what I like to think and what is reality is several things completely. But anyway, I appreciate it.
Thank you, Bill. Thank you, everyone. I'm going to be blind before the end of the night. Can you hear me back there, by the way? Oh, you got. Oh, this one is for this. All right. Thank you. And see, I come out of a technology background, and I can't figure that piece of it out. So, thank you very much. It really is a pleasure to be here. This weekend was I'm Greek Orthodox, and it was Greek Easter over the weekend, and my wife and I, we live in Rye, and we drove to Concord, have family there, had Easter lunch, and then we spent the night up in Littleton, and then went up to Colebrook yesterday and spent the day up in Colebrook. And I did that because back several years ago, the late, great Ray Burton would asked me to come up to the North Country, and I've come up to the North Country on a regular basis because it is so much different from every other part of the state. The needs, the issues are so different. And up in Colebrook, I was especially touched up there because of some of the issues that they were dealing with long before the rest of the state started dealing with, when they lost the mills and some of the other things. And Ray would get me up there to a lunch that was potluck lunch to have a number of the providers. And you go up there and they're dealing with such unique challenges up there, and yet I would walk away just feeling inspired because of the level of collaboration, the way they worked with each other, how creative they were, and how compassionate they were for the people that they serve. So. And I really thank Ray for, look up above, and really thank him for getting me in touch with that particular group up there. And so it was important. Yesterday was important because I had with me throughout the whole trip Senator Jeff Woodburn, who is the majority leader in the Senate. And I also had Councilor Joe Kenny, who was with me for the whole trip, so that he got exposure to all the different issues, as did Senator Woodburn, and each one of them learned, I think, quite a bit about what some of the issues were. So what I'd like to do is, in my little time here this evening, is give you the big picture perspective in terms of what is going on. I'm going to talk a little bit more about the budget and where we are and what the next steps are, and give you my perspectives in terms of what I think is going to happen. I have a number of conversations with people both in the House and the Senate. And one of the things that I want to tell you that in my role as the commissioner, I have to have a dual agenda, and I don't mean that in a political way. One agenda is I have to manage for the present. And the fact of the matter is that we're living with fewer resources in the face of increasing and complex demand. But at the same time, we're a mission-driven organization. And Bill, you eloquently said what it is that we do. We're really around health and independence for children and families, for adults, for seniors and the general population, serving their human services needs, their developmental services needs, their behavioral services needs, their medical needs, and then just the general public health, the health and safety of the population. So it is an enormous task to look at how do you manage with fewer resources. So at the same time we manage the resources, the other part of the agenda is look to the future and say, try to create a vision in terms of where we want to go moving forward. And I like to frankly characterize it as thinking of government which is vital for everything that we do and the people of New Hampshire. And I want to try to change the dialogue from talking about big government or small government to smart government, because there's a number of things that were done in the budget that I'll talk a little bit about that make no sense whatsoever. And so that's some of the things that we need to talk about moving forward. So let me just first off start with the budget in terms of where we are right now and what it is that we're doing there and what impacts that's had, and then talk about where we are in the House phase of the budget and a little bit more detail in terms of the impacts that the House budget has had, and then where do we go from here. The department produces on a monthly basis something I call a dashboard, which basically looks at and projects where we believe we're going to be with our budget at the end of the fiscal year. And since the beginning of this fiscal year, we're in state fiscal year 15, goes July 1, 14 to June 30th of this year, we have been projecting a $60 million general fund shortfall. That's 60. Out of a general fund budget that is roughly $613 million. So that's about a 10% hit that we've taken. I'm going to talk to you about why that is, in addition to what we need to do in terms of managing that particular shortfall. There is an expectation on the part of the general court that we will return to the general fund another $26 million in so-called lapse. That is essentially with any budget that you have, you're not going to spend every dollar that you have, and there's an estimate somewhere around 2 to 3% of the budget you will return to the general fund that the general court, the legislature, will use that as you prepare for the next budget. That's very, very challenging this time around. So the budget shortfalls that we've experienced have been driven by several factors. One is something called the back of the budget. What the legislature will sometimes do, they always do actually, each budget that I've gone through, is the budget will get passed and then they will give me, and invariably it relates to personnel, and it will say you're not going to fund all the positions, so you need to return $7 million. You need to reduce your appropriation someplace in the budget by $7 million. So right off the bat, whatever the budget I have is got to be reduced by $7 million in order to meet that. Now the department we're now at 2,981 authorized positions. We have right now 350 vacancies. And we've been carrying 350 vacancies in order to basically try to fill some of the budget holes that we've had over the year. That's difficult to do when you look at what the portfolio of what the department does. We have a state hospital, the New Hampshire Hospital. We have the Glencliff Home just a few miles up the road here. We have the Sununu Youth Services Center. We have the designated receiving facility in Laconia. And those are 24/7 facilities. I don't have the option of saying we don't have people there. My point is 60% of the people that I have within the department are direct client facing. So it's either in those institutions, it's the child protective service workers to go off and investigate abuse and neglect for kids, adult protective service workers, which is an increasing issue that we have with our seniors, people exploiting seniors, as well as other front-facing people within the department. Again, 60% of those positions. So when you have to keep 350 positions vacant, it becomes very difficult for us to fulfill the work that we do. We have, one of the things I'm going to talk about a little bit more is about the health protection program, but the budget, the shortfall that we have was that there was a bipartisan agreement that came together. The Senate, Senator Forrester that you talked about, Senator Morse, Senator Bradley, were very much instrumental in terms of working with the governor in order to pass what is called the New Hampshire Health Protection Program, or our version of Medicaid expansion. That's the great news. The other part of that news is that I wasn't giving any dollars in order to basically implement that. So what we needed to do was come up with money elsewhere within our budget in order to fund the staffing, in order to fund the systems work, in order to fund the various contracts that we needed in order to basically set up that particular program. We also, you mentioned a little bit earlier about the mental health agreement. That mental health agreement came about, it was a lawsuit by the U.S. Department of Justice that basically alleged that the state of New Hampshire was needlessly warehousing people with mental illness. Now, I have a state hospital of about 150 beds, and I have a population of 1.3 million people. I still scratch my head in terms of how I can be warehousing people when I've only got that number of beds. But be that as it may, the U.S. Department of Justice, along with a number of others, came in and basically said, these are the things you need to do. They're not bad things to do. There are a number of things that are the right things to do. Unfortunately, for the current fiscal year, state fiscal year 15, it's around $6 million that we did not have or budget. So we needed to come up with that elsewhere within the budget. I'm going to talk about what we need to do in state fiscal year 16 and 17. Another area that is probably the biggest challenge that we faced, and it has both a good issue and a bad issue. The federal government, under the Affordable Care Act, or Obamacare, as a number of people will call it, basically said, when it was passed back in 2010, that Medicaid expansion was going to be mandatory for states. And the Supreme Court ruled that that was an onerous proposition on the part of states, and they made it an optional issue for the states. However, what the federal government did in anticipation that it was going to be mandatory is they eased up on the eligibility calculations and how people would become eligible for the program, that had the net effect of easing that, and we saw an increase in the number of people who became eligible for the Medicaid program. Not Medicaid expansion. This was going to happen whether or not the state did Medicaid expansion or not. And that number surprised all of us, because it ended up to be about 11,000 additional people that we estimate is going to be about $20 million in general funds that it was going to cost us this year and then into the subsequent years. And that's the bad news. The good news is that the majority of those people are children. And so for the first time, you're going to have many of the children are going to be able to get care for primary care physicians, the wellness checkups, all those other type of things that really can start forming the foundation for the future. A number of people will talk about building a state economy, a vibrant economy, and so forth. It really starts with kids. If you don't have healthy kids, if you don't have well-educated kids and so forth, you can recruit all the businesses you want here, but if you don't have a good workforce, and it really doesn't happen just because the kids are going to college. It really starts at a much earlier age. So we have that $60 million, we have addressed that. Unfortunately, part of that did impact the counties and the nursing homes because of we did not pass on a surplus. I'll take that as a question afterwards if you wanted to go through that. That's still a work in progress, but I know that was that remains a flashpoint for the people in the long-term care community. We did not cut the rates for nursing homes. What we did was we did not pass on a surplus that was generated in the prior fiscal year, state fiscal year 14. I know I may be in a little bit into the weeds, but let me bear with me for a moment. So much has been made about the budget in terms of where we are, because the process for budget, again, it really begins, it's like birthing a baby. It really begins with an agency budget that each one of the departments submits in October of last year. Then we go to the governor's budget, which the governor has to, by law, present that by February 15th. This year, February 15th happened to be on a Sunday. And so generally they would look to Friday, but Friday would have been Friday the 13th. So the governor wisely chose to do it on February 12th. So she presented her budget on February 12th. The department worked very closely with Governor Hassan in order to basically craft a budget that she believed, and I believed, was a responsible budget given where we were. The House then, and that budget, my budget right now in state fiscal year 15 is roughly $613 million in general funds. I'm only going to talk general funds. I'll make reference to the federal funds in a moment. The governor proposed a budget of $649 million, so going from 613 to 649 million. The House brought that down to $604 million. That's for the first year of the biennium. The second year of the biennium, the House decreased that to $590 million, whereas the governor had brought hers up to $665 million. Now, much has been made, and you were referencing that a little bit earlier, that several members of the House have indicated that the department has actually got more money than what we did in the last biennium. And technically speaking, that is true. But let me give you a couple of other pieces of information. The changes in terms of what the House did, and this was in the budget, the department needed to come up with funds that would have been generated by the Medicaid enhancement tax that went elsewhere, and now we needed to come up with $80 million in order to cover that over the course of the biennium. So that's $80 million that the House said we're going to flat fund you and keep it where you are, but you got to come up with $80 million elsewhere in order to basically pay for that. There's no discretion there. I don't want to do that, and so forth. We really needed to do that. Second thing that we needed to do was we needed to fund the community mental health agreement. It's $25 million. That is in the budget, in the House budget, to pay for the $25 million, which is the DOJ settlement that we needed to do for a number of different services and infrastructure that need to happen there. And then the third part of it is that the carry forward on that 11,000 kids thereabouts that we brought in. It's called the MAGI, the Modified Adjusted Gross Income, a different way to calculate eligibility for some populations, not all populations. And with that, that generates an additional $30 million general fund obligation. So they said, you do all that, and we're going to pay for that, and we're going to pay for that out of the budget, but you need to come up with reductions elsewhere in the budget. And that's where the impacts are just huge to people. So let me give you, not to make you any crazier than maybe you want to be at this point, but there is not one segment of the populations that we serve. We serve children and families, adults, seniors, the general population, around a number of again, human services, developmental services, behavioral services, medical services, and public health. So some of the things that we did. So we funded mental health services, But for anybody who knows the issues related to mental illness, and I do believe mental illness is probably one of the most pervasive issues that we face as a state. The cost of this just manifests itself in areas. It's in corrections, it's in local law enforcement. We've got an epidemic going on right now in some parts of the state regarding heroin and other type of things that have a relationship to the issue of mental illness. Impacts education, impacts the county corrections, impacts the state corrections. What goes hand in hand with a mental illness? Substance abuse. So what was funded was mental health services, but virtually every dollar that the state spends regarding substance abuse was discontinued. The Governor's Commission on Alcohol was basically defunded. The governor added an additional $6 million to the Governor's Commission on Alcohol. That was taken away. The New Hampshire Health Protection Program, which again I'm going to talk about in a minute, which brought treatment services for substance abuse, that was eliminated in the budget. It doesn't make sense to say I've got one part of it and then I'm not doing another. Services to seniors. It wasn't just Meals on Wheels. What the legislature did was we have a number of services social services for people to keep people in community. Meals on Wheels, congregate meals. And I know I've been here where people will come here for a congregate meal. Transportation, home care, respite services for people who are caring for their elderly parents or in-laws. And what happens there is that those services, they're social services that keep people in the community, and they keep them out of the much more expensive venue, which is in the nursing home. So what the legislature did was basically cut it by 50% each year. And then part of what they wanted to do was basically say, Commissioner, we want to give you the flexibility so you can prioritize the delivery of home-delivered meals. And my point there is that with a 50% cut, there's a number of people who provide those services are relatively small providers. They can't absorb a 50% cut like that. They will go out of business. And that's a real concern that we have. Nursing homes. The state assesses a tax to nursing homes on nursing services, it's called the Nursing Facilities Quality Assessment, that generates a tax. That a portion of that tax is used in order to basically fund the MQIP, which closes the gap between what Medicaid pays and what the cost of the nursing facilities are. Generally, we would get that, and then we would pay out 100% on the MQIP. They cut that back to 75%. There's going to be an impact to the county taxpayer on that. The other area that was done there was in the I just blocked on that one, but we also I just lost my train of thought. That's what happens when you get to be old. And I'm on camera, no to boot. So we also cut, again, these are areas, there was cuts to developmental disabilities, there were cuts to children's services, there were cuts to public health. There was not one area that was not impacted. And then at the final, the final amendment that was done in order to get the budget through the House, $2 million was cut out of the New Hampshire hospital in terms of basically saying cut 7 nurses out of the New Hampshire hospital. Now, across the state, every day you have people sitting in the emergency room of a hospital, children, adults, because they can't get into the New Hampshire hospital. By cutting nurses, by cutting those nurses, I'm decreasing the capacity that I have, and I'm only going to exacerbate the problem in terms of creating more of a waiting list for people to get into the hospital. There's a number of other things that we have. So let me give you my perspective in terms of where things go from here. One of probably the most significant issue that's being discussed right now, as you were referencing, it was the New Hampshire Health Protection Program. That's the Medicaid expansion. So where are we on this program? Medicaid expansion and the Health Protection Program serves basically people from 19 to 64 years of age who are under 138% of the federal poverty level. And that means for a person is about $15,000 to $16,000. People above that limit can go to the federal marketplace in order to get coverage, and the lower the income, the higher the subsidy, the higher the income, the lower the subsidy. But anybody under 100% of the federal poverty level gets nothing if Medicaid expansion were to go away. So as of yesterday, we now have 38,000, well, just over 38,500 people who are enrolled in the Medicaid expansion of the Health Protection Program. I have that number. So somebody was talking about earlier, what can you do? I'll tell you what you can do. Because I have a little diagram here, and I'll be happy to send it to you. It's on our department's website. But we break it down by county. So for Coos County, 4.7% of the, now this was as of last week, late last week. As of late last week, we had 4.7% of the entire population of Coos County was enrolled in the New Hampshire Health Protection Program. In Grafton County had 3.4% of the population enrolled in the Health Protection Program, except if you need to put aside Hanover and Lebanon, which was a much smaller amount, it was 1.4%. So I don't have what the blended amount is, but clearly there's for the remainder of Grafton County, outside of Hanover and Lebanon, was 3.4%. Carroll County was almost 3.9%. Belknap County, almost 4.2% of the population. You go into other parts of the state, it's a smaller percentage, but the numbers of people are much higher. This is really the percentage of the population. Now, what we've also done is we've broken it down by town. And it's a color-coded, so you can look at Grafton County, and wherever you look at Grafton County and you see some orange or red, that means it's a much higher percentage of the population in those particular towns. So we're making these figures available so that when people want to call up a representative, and I'm not an advocate for doing these sorts of things, but I'm just giving you the data. The data basically says, you know, I'm going to call up Representative so-and-so to say, by the way, did you know that you have 500 people in your town that are on the Health Protection Program? Now, I will also tell you, I believe very, very strongly that the leadership in the Senate wants this to pass. They want this to be reauthorized. I was at a function not too long ago with Senator Bradley, and Senator Bradley was the Center for Nonprofits. Senator Bradley spoke to the people and said, what you need to do is you need to call your representative and you need to tell them the program is working. The program is working. Senator Bradley coined the term that the uncompensated care was a $400 million tax into the state. Uncompensated care is care that is provided through hospitals, but they're not being reimbursed by Medicaid, or they're losing money by taking the Medicaid clients. That's just hospitals. If you talk to people in the community health center, because you have a wonderful community health center here under Sharon Beatty, and she will tell you, prior to the Health Protection Program, better than half the people that she served were uninsured. If you talk to the people in the mental health center, they will tell you that better than half the people that they served were uninsured. That now is changing. Those people now have access to care, access to coverage. And it's important that people talk about not the numbers, but talk about the stories. And that's what Senator Bradley was talking about. That's what I believe you listen when, again, as representatives of the people, when somebody will call you and say, for the first time, I've got my medical condition being addressed, and now I can have a full-time job. Those are the type of things that I think people need to hear. The numbers are great. We're working with hospitals, working with others to come back and say, we've seen almost a 20% decrease in ER utilization for the uninsured in the first quarter as a result of the program. We've seen a similar reduction in the admissions for inpatient as part of the uninsured. That's got to translate into some dollars someplace, and that we need to get that there. So the program, I do feel very, very strongly. I don't know for sure where Senator Forrester is, but I know the issue of mental health and substance abuse is a very important issue to the senator, and what I will be reaching out to her this week in order to get prepared for the sessions that we're going to begin with the Senate in the coming couple of weeks. But the piece that is a bit of a sticking point is, and you were referencing it earlier, the health protection program or the Medicaid expansion funds the services 100%, the services, until December 31st of 2016. Thereafter, there's a 5% requirement for the state for that last 6 months. It will, if thereafter it decreases by, increases by a couple of percentage points in terms of the state share, leading up in 2020 when it's 90% federal, 10% state. So with that, we will then have the liability right now, the estimate that we have is about $12 million. So the question is, what will the Senate do with that? And again, I don't have a crystal ball in terms of what they're going to do in that area, but clearly that's really one of the critical issues that needs to be discussed in the upcoming budget. Other things that we are doing, again, talking about looking toward the future, there are things that we're doing. We're trying to implement a managed care program for the state. I do believe that it is the right type of a program. We clearly have had some challenges in terms of doing that, and we have additional phases that we will do in terms of bringing for certain portions of the population, mandating everybody in by July of 2015. Then the Choices for Independence, which is really services for the elderly, community-based services, in January of 2016. And then in July of 2016 would be the nursing facility services, and to be determined when we will do services for the disabled population. Now, other things that we are doing, we are in the process of trying to secure a waiver from the federal government. It's called an 1115 waiver. And what we're doing with this waiver is to try to change our delivery system specifically around the area of mental health and substance abuse. There's work that needs to be done in terms of developing a workforce. We need to do more things in terms of driving a greater level of integration of primary care and behavioral health and substance use services. That's critical issues that we need to deal with there. And what we're doing is we've got a proposal into the federal government that seeks to identify the costs that are being borne by the state for these particular areas and that are not being matched by the federal government. And then turning around and saying, use that so that the federal government essentially becomes an investment partner with us in terms of looking at building some capacity for the future. It's not going to pay for services. What it's going to do is help enhance the capacity in terms of infrastructure development, workforce development, and so forth. So I think I have like 15 minutes, so maybe I should just stop there and see if there are any questions on some other thing. I've thrown an awful lot of data and information at you, but I'll just open it up for any type of questions that you may have. Yes?
Of course. Talking with the representatives, in some cases we're preaching to our own choir. On the other hand, I know that many of the opposite party have taken a pledge, the Coke pledge. So we could talk to them till we're blue in the face, and they have made this inane, despicable pledge. I don't know how you're going to change that unless you can talk one-on-one, and then O'Brien and his minions. So there's one problem. The second is the... Can
I respond to that, Martha? One of the things that we've done, we did it in the House, and we've just updated it now for the Senate version, is when the department is asked to make a reduction, there's no guilt-free reductions here. So what we do is we put together a series of detailed impact statements and basically say, to the extent we can, how many people are going to be impacted, where are the costs going to shift to the county, to the local government, to the schools, to the communities, to the families, and so forth, so that we try to give them a very clear perspective in terms of you can cut the budget, but it doesn't mean that the spending and the need is going to magically disappear. It's going to manifest itself someplace. And so it's up to us to try to connect the dots, so to speak, so they can say, if you do this, this is what the impact is going to be. It's not 100, it's not precise, but it clearly, we can tell them where, and in some cases, we can tell exactly the number of people going to be impacted and where the costs are going to be able to shift. What they do with that, what people want to do with that is yet another matter, but that's where people's voices really need to come out and be heard.
And I don't think they care. That's how most of us feel when we hear this. They don't care. But there must be Republicans with developmental issues. There must be Republicans in college.
Bill O'Brien.
So that's number one issue. The other is the implications of aging in this state, in this region, and up north. It is huge what is going to be happening, more than what we're seeing now. And it's not bringing in the young people. They're fleeing, like, you know, all the issues.
Yeah.
They're just kind of kicking that down the road. Funding in there for the future.
I really believe that, as a matter of fact, we are having some meeting on Friday with a number of members of the counties to talk about the financing system for long-term care. I mean, I will sometimes joke, and I'm not joking really, that I would have an easier time explaining Einstein's theory of relativity than I could in terms of how long-term care services in the state are financed. It really doesn't make a whole lot of sense, but that's the way it is. And so I think people, as a result of some of the things that have happened, I think there is a receptivity and a desire to step back and say, let's look at it. So we are going to talk about the future. We're going to look at the silver tsunami that is not just coming, it is here, and what that means, and especially up in the northern tier of the state, up in this area, because the impact is that much more magnified for the reasons that you talked about.
We don't have enough beds for these folks, enough services. You know the issues.
Yes. Yes, ma'am.
Whatever happened in the tobacco settlement? Did you get any of that?
No. One thing, somebody had mentioned the gas tax earlier, again, I have to play everything sort of right down the middle, but this is a fact, so I'm not stating anything other than a fact. I travel 35,000 miles a year back and forth from Rye, New Hampshire to Concord. Now, you may question my sanity in terms of doing that, but it's 35,000 miles. I get roughly 30 miles a gallon in my car. So I looked at it and I said, all right, 35,000 miles, 30 miles to a gallon. How many gallons of gas am I doing? At 8 cents a gallon for tax, and how much that's going to cost me? $1.75 a week. And that's 35,000 miles. And most people don't drive 35,000 miles. Most people drive 10,000 miles. So take, what is it going to be, 60 cents that it's going to cost them. to not lose your teeth when you go over one of these potholes. I mean, transportation does a great job, but I mean, it really is at the local level, you know, in terms of the bridges and so forth, the number of red-listed bridges in the state. My former colleague, Chris Clement, was passionate about making the point in terms of the red-listed bridges and the need for an investment in the infrastructure. Yes, sir.
Could you speak briefly on how well you've managed to live up to the mental health settlement agreement, which was imposed, well, it was not really between you and them, it was between the Attorney General.
Yeah, well, it's left to us to implement it. There are a number of the components of the mental health settlement that really build on something that we put together a number of years ago called the 10-year plan that really emphasizes community services, assertive community treatment teams and so forth that really keep people out of the emergency room and so forth. So there are a number of things that build on that, and the community mental health centers are tasked with a lot of it falls to them in terms of being able to do that. And some of our community mental health centers have some fragility in terms of their financial capability, in terms of how they can really move this along. But they're doing their best in order to do it, and we're doing our best to help them. The area that is kind of interesting, where we're treading a little bit of new ground, is some new type of capabilities called the mobile crisis teams and mobile crisis apartments, which instead of having people come to a facility in a particular community, it's the community goes to wherever the point of crisis is, whether that's in a home, whether that's in a business, whether that's in a school. It's a very different model. It has been used in other parts of the country, primarily in more of the metropolitan areas, but nevertheless, it is something that we're going to pilot that. The idea is to pilot that in one region of the state.
Commissioner, I agree that these are excellent plans, but to what extent are they just plans? Where's the money?
Well, the legislature has provided us the money. I had to cut other areas in order to basically make the funding for that. And I agree with some members of the legislature when they say this. What the settlement requires us to do is to stand up the capability. So if I estimate it's going to cost me $3 million in order to do that, if I can do it for $1.5 million, I'm not going to get in trouble as a result of doing that. So it's really looking at what the capabilities need to be established, and the agreement is very specific about the things that you need to establish. And we're working our hardest in order to try to move that along. But again, and we're doing that right now, and we'll have additional dollars that will come, assuming the budget, that part of it remains in the budget. If we don't do it, if we choose not to do it and not to follow through on it, then I'm going to have a lawsuit that would be coming our way, and that would be just the wrong thing to do, because now we'd be spending real good dollars and basically spending it on, with all due respect to attorneys, we'd be spending on a bunch of attorneys. Yes.
Earlier you spoke about the decrease in the uninsured that were taking advantage of emergency rooms and services like that, but I don't think you said why there was a decrease.
Because they now have insurance.
From the Affordable Care Act?
From the Affordable Care Act.
Why didn't you say that?
Oh, I'll say it right now. That they are, those people who, the decrease in the uninsured is driven by two factors. One is the Affordable Care Act on the Medicaid expansion, the 38,000 that we have, that there's also another 40,000 plus that have got the individual mandate from through the federally facilitated marketplace, and those folks now have insurance so that if they do present themselves into the emergency room, it's not going as uncompensated care.
I understood that.
Yeah, that's really where what the Senate and the legislature, I think, are looking for those type of numbers. I can't provide the numbers in terms of what that means in terms of dollars. The only people that can provide that are the hospitals. I do know that community health centers are speaking up, the community mental health centers are speaking up, because that really does have an impact. The program actually strengthens the safety net for that set of providers. Those questions over here. Yes, sir.
What happens to the folks over in Lakeview, over there in Effingham? You've closed that unit. Where are they going?
They're going to next space.
But here's the issue with this is probably obviously a complex situation. We now have roughly 11 to 12 people in that facility. There's still a number of people from other states that are there. But here's a case of where I will sometimes use the phrase, today's problems come from yesterday's solutions. Let me explain what I mean by that. Back in 2009, November 2009, as a budget savings measure, we closed a wing at the New Hampshire hospital, the eye unit, the neuropsych unit at the New Hampshire hospital, with trained doctors, trained nurses, and so forth that deal with brain injury, mental illness, developmental disabilities, very challenging behaviors, that provided a safety net and a safety outlet in order to allow area agencies as well as others to develop a plan in order to put those folks back out into the community. When that facility closed to save money, what that did was the area agencies needing time in order to basically develop alternative plans in order where to place people, and went to one of the few facilities available, and that was Lakeview. Now, we did some numbers. The 5 years prior to the closure of the eye unit, the state had 12 admissions to the Lakeview facility in the 5-year period prior to 2009. In the 5-year period since, we've had 77 admissions to the Lakeview facility. So in a sense, it's changed its focus. And so what we need to do right now is we've got a plan, a correction plan, working with the facility. There's a number of things that we need to do both in the short term and the long term. The report that was done exposed some weaknesses in terms of either staffing or training, some other type of things that we're culpable for, and I'm trying to address that. The idea of having a facility like that just summarily close is something that there are a number of things that I roll around in bed at night thinking about. That would be one that I would be very, very troubled by, because now you have a situation that is already a difficult situation up there, and now if staff at a facility like that all of a sudden perceive like, well, the state is going to close this facility, the natural reaction on the part of some of those people would be saying, I'm going to leave. So we really are working very hard with the facility, holding them accountable, making sure that they follow through on the plan of action, at the same time working with our area agencies in order to develop alternative and other type of transition plans that at the a choice of the family in terms of where they want to go. There are a number of people families that have people at the Lakeview facility that are quite happy with the services and the capabilities, and there are others that are not so. And so we're the report that was just issued yesterday really demonstrated that there were some challenges that we clearly need to work. I've spoken with a couple of the media people today, and my team is working very closely in order to try to address the issues up there. Well, from my standpoint, my role, revenue generation is above my pay grade. Unfortunately, that is not something that I'm given a budget and I need to work in order to try to squeeze every dollar that I can and make it try to fulfill our mission. But we are getting at a crossroads where. I said earlier, I have a dual agenda. One is for managing the present and to try to be as efficient and effective as we possibly can with every dollar that we have. But at some level, the gap between the growing need, the growing complexity of the need, and that's one of the things, again, we're projecting our caseloads over the next couple of years will actually decrease as a result of the economy. I think some of the issues that we're seeing in the long-term care system, people have a few more assets and they're delaying before they need to go into a nursing home or needing other type of services. So, but those numbers are going to continue. At some point, they're going to continue to grow, and we're going to reach a point saying you can't make yourself more efficient. You can't close the gap by just being more efficient. At some point, you have to stop and say, how are we doing this in the first place? And then asking yourself the question, saying, what is it that we're not going to do? Then it really gets back to what the commissioner is saying, where are the costs going to shift? And at some point, again, all of us as citizens, as taxpayers, need to recognize that at some point there needs to be a more stable and sustainable source of revenue. I'd settle for stability in terms of the revenue as opposed to more or less of it. I would rather have that not subject to the fluctuations of how much somebody is going to drink, how much somebody is going to smoke. All you can do is to try to have the conversation with them. I think at some level, I talked to my wife about this. I'm 7.5 years into this role. I love what I do. I am honored and privileged to do this job, and because of the people that I'm able to help. I mean, I can help a little old man across the street, or I can help a couple 100,000 people who are on the Medicaid program and some of the other programs. So I feel that I try to do the best that I can. But at some point, just trying to talk to people as human beings and let them know what the impact is going to be. And that's really, at some point, it has to be, the connection needs to be made. I don't have a silver bullet in terms of how that really works, but we're all wired a little bit differently. We all look at the world in a different way, but these are our neighbors, these are our family members, these are and so forth. And I just think that we just need to try to do the best that we can for those individuals. I just don't have a silver bullet on. I'm only talking health and human services. Granted, we're a big part of the budget, but what happens with transportation? What was going to happen there? What happens with the environment? What happens with you talked about revenue administration and so forth? It's just across the board. But at some point, there needs to be another look at it. I will say the Senate, again, the advantage that the Senate always has going through that, and I think most of you understand that, is that the revenues become a little bit more, you understand where the revenue, when you're trying to do it back in the House phase or in the governor's phase, it's still too far away, tomorrow, right? Where the deadline is everybody's got to pay their taxes. It's not an accident, in my mind, that my first budget meeting with the Senate Finance Committee is on Monday, because now they will have a view in terms of where the revenues really came in the month of April. I do thank you very much for your time and attention.